Welcome to Health Assessment. This summer is a little fast and furious, so I'm going to try to post brief little walkthroughs to highlight some of the more important information that you can gather throughout the chapters, so it doesn't feel so overwhelming to you. I'm also hoping that I can empower some of my auditory learners and kind of keep you on target. So welcome to week 1, and this is Introduction to Health Assessment. Now, that initial piece of health, what is health in general? And it's that state of complete physical, mental, and social well-being. It's not just the absence of disease, right? But it is actually a holistic view of multiple facets that make up a person's overall health. And the book identifies 6 facets, which you can see in my cool little pie chart: spiritual, physical, mental, social, cultural, and developmental. And that it is not any one piece, but we are actually made up of an entire mix of facets of health, and that a disruption or interruption, as we've seen, socially and mentally, they all impact each other. Right? So with the global pandemic we're in, we've had a lot of disruption, and it has impacted other aspects, right? Even developmental aspects or that cultural connection, spirituality, and we have seen it in the hospital setting with an impact on the physical as well. So looking at Healthy People 2030, I just updated it on our shell, that there's a link there, so you can actually click on the link, follow through to see what our U.S. Department of Health and Human Services identifies in the Healthy People 2030 goals. And this is a framework that identifies those risk factors, health issues, and diseases that are problematic in the United States in particular. And it kind of highlights those things as well as goals and objectives to improve those identified issues and promote health and disease prevention. Question 1. Oh, my thing's a little bit off on my image is off my video recording, sorry. So Healthy People 2030 is based on which of the following: A, results of Healthy People 2020, B, current data, C, new developments, D, emerging challenges in the U.S., or E, all of the above. And I feel like this one's pretty much an easy one. It's all of the above, right? So they take the results from 2020, and those are based off of results from 2010. So it is a purposeful look at the current data and new developments of the health in the United States, and then meeting those challenges with goals and objectives to improve the overall health of our nation. Now, health assessment in general. The definition, right, we talked about that there are multiple facets that feed into overall health. Now, looking at health assessment is how do you now evaluate the health of a person? And there are multiple kinds of health assessments, right? There's the comprehensive, where you're looking at everything, past medical history, cultural, spiritual, social, physical, psychological. There's the complete physical exam, which is the head-to-toe exam, right? And you document and collaborate your findings with the medical record. There are focused health exams. There are problems-based health exams, right? And as you can imagine by the names of them, they are all a little bit different. If it's a focused exam, you're not going to do that complete head-to-toe. You're going to be focused on a particular system or systems. Now we're going to step into the nursing process, right? The overall goals of the nursing process: to extrapolate findings, prioritize findings, formulate a plan of care, and implement that plan of care. We probably all know ADPI, right? So preventative care, there are 3 levels of preventative care, and make sure that you understand these and you understand examples of them, okay? So primary prevention, which focuses on improving the overall wellness and protecting from disease or disability. Secondary is early detection and treatment of a disease that's curable or has few complications or disabilities. So this is a very beginning piece of disease. And then tertiary is decreasing the effects or the impact of the disease or disability when preventing the complications or the loss is permanent. So it's already in place at that point. Make sure as you are reading through this that you understand those 3 levels of preventative care, and you can provide examples of each and why. So my examples on this PowerPoint, for primary prevention, right? Immunizations, environmental measures, you can read through accident prevention measures, reducing risk factors, occupational measures, health education, right? That's primary prevention. Secondary prevention. This is your routine screenings, right? Your early treatment of disease, your self-examination, even the breast self-exam, and then communicable disease control. And then finally, our tertiary prevention, rehab programs. This is someone now who has the disease, and you are trying to prevent any possible complications and in that continuum of health. Promotion of employee rehabilitation, right? Sheltered communities, prevention of skin breakdown in immobile patients. There are many aspects of the levels of prevention, so just be familiar with them, what they mean, and examples of them. And now we're going to move to the role of the nurse. Now, for those of you who are just entering the nursing profession, I mean, I have kind of a range on my introductions, which I love, because it gives us a great diverse pool where you guys can kind of bounce back and forth from each other with really interesting stories and information, and it makes for an interesting class. So the role of the nurse, right, is to oversee that holistic care. So we talked about those 6 facets earlier, right? To be hyper aware that each one of those pieces feeds into the other pieces. And so when you're looking at a patient or a person, that you're seeing them as this sort of continuum with really complex and complicated interweaving of these different facets. Nursing-wise, we collect data, right? We get that information, baseline information, presenting complaints, vital signs. Those are all data points. We make judgments that impact patient safety and take advantage of those teaching opportunities, right? The nurse tends to be with the patient for a lot longer, and so we have a greater duty and capacity to impact our patients in their trajectory, because you need to have that patient engagement. Identifying what is important, right, on a daily basis for each patient. We absolutely prioritize care and prioritize focus on education as well. Watching and listening to kind of find that baseline of what needs to happen and knowledge gaps if they have any. And then also triaging mentally if there's an emergent situation, right? We are the ones who identify critical changes in a patient, and then learning to detect important changes, right? And then what do you do with that information? Because we are part of that healthcare team. All right, patient data. So there's subjective and objective. So you've got, as you're charting, you've got subjective and objective findings. And people will say subjective has that S, and it's what the person says, right? And then objective are what you observe. So I'm just going with the simple S and the O. But objective data is measurable, and subjective is what the patient tells you. Be aware of what that is, not only for this class, but also for the lab, because you're going to have to chart on Shadow Health, and you're going to have to identify subjective versus objective data. So as you are refining and practicing your charting, make sure that it's clear and concise and does not have judgment or assumption. And that can be as simple as, you wouldn't say patient is angry. Instead, you paint the picture. Patient wringing hands, appears anxious. You can say that. That's your judgment. And then you can put in quotes things that they say that also feed into your assessment that would say that they're angry. Patient states, quote, "I'm angry, and if this takes any longer, I'm out of here," end quote. Those kinds of things where you are avoiding judgment, but you're charting clearly and concisely to paint the picture of that patient's overall health. So back to the nursing process we touched on very briefly, but you all hopefully are very, very well versed in ADPI, right? The process of nursing: assessment, diagnosis, planning, implementation, and evaluation. And as you can see in the little pictogram, that is a continuous cycle. When you get to evaluation, you use that evaluation to then feed back into the loop of the nursing process. Now, for interviewing, I'm stepping through the topics very quickly because it's many chapters. The very, very beginning of an effective nurse interview is to know your own biases and to understand your own limitations. If you are not the right person to speak to this patient, then step out if that's possible. An example would be a rape victim whose perpetrator was a male, and then the nurse is a male, and they choose, maybe they're not the best person to engender an open and a safe place for that patient. And it's not because of the nurse, it's because of the nurse's ability to assess and critically think what's best for this patient. So maybe they say, oh, is there any possibility we can swap assignments? And that's absolutely reasonable. So the very beginning piece of interviewing effectively is know thyself. Understand your limitations and your internal biases, and recognize and self-reflect on a continuous basis. Going forward, right, reviewing diagnoses, setting goals, reviewing behavior, adjust the environment, right? You want it to be a safe, a quiet, an open environment to encourage the patient to engage and interact. And then taking notes, right? It's easy. You have the discussion. I can't tell you how many times I say, okay, 0 to 10, how would you rank your pain? And I walk out, I'm like, they say 4 or 5? I can't remember. So having a safe place that's open, and available for the patient, but also making sure that you are taking notes on the information, especially if it's a longer interview. The phrases of interviewing, be sure that you understand, right? When you're looking through the book, pre-interview, introduction, the working phase, and the termination phase of interviewing. On therapeutic communication, I think we all know this, but just as that reminder, be an active listener. Those open-ended questions, that's almost always the right answer on any of your nursing questions, right? Or your nursing exams, where you have an open-ended question that allows the patient to now begin that conversation, not a yes or no. And then actively listening. Providing nonverbal communication. So much is dependent upon our body language and expression, our facial expression. I mean, we see that with all of our masks. The challenge of being limited on the nonverbal because we read so much on someone's face. And then ensuring that you infuse empathic responses, right? If somebody says, I've had a really hard time during this pandemic, it's not a time to just kind of nod your head, right? This is where you step in to empathize and to reach into a piece of you that also recognizes that feeling. And then validating, reassuring, and always use interpreter services whenever possible. If there's a language barrier, you are always tasked with providing the best possible situation and care for your patient. Now, looking at my comprehensive adult health history, right? Here's a big old list of all the stuff that's included in my comprehensive health history. Final little piece. In the PowerPoint itself, there's a little Kahoot, and it's a fast little one where you can just tap through to see if you have any kind of areas that are not very clear to you. So it's a very fast run through, but I thought I'd highlight some of the more important pieces for this week 1 with these chapters 1 through 4. Thanks so much. Bye.